I'm Aida Kurtovic from Bosnia and Herzegovina, and it's great pleasure to be with all of you this morning here together. So we are going to spend next hour speaking and discussing the Balkans response to COVID-19. And this is the experience that we want to share from the regional SOS project, which is led by the Alliance for Public Health from Ukraine and its partners working in Balkan countries. So without further ado, I want to invite Tetiana Deshko, who is the head of the International Program Department of the Alliance for Public Health from Ukraine. So Tanya, over to you, please.
Thank you very much, dear Aida. Colleagues, on behalf of Alliance and SOS Project, we are delighted to welcome you in this great meeting. Well, COVID caught us in the middle of our 3-year SOS project, and despite the tremendous challenges that it brought to health systems, to community systems, to our lives, we positioned COVID as actually the time of opportunity to make important revisions in how we work and to take important lessons for our daily activities on HIV, on TB, on malaria too. COVID made us faster. Now we can get daily data on the status of epidemic in the world, which has never been like that before. COVID made us more cost efficient. We finally started using IT. We have developed adaptive logistics system, which can very quickly accommodate and revise supply chains for commodities and for drugs. It also finally made us more patient oriented, where people finally have the luxury of staying at home with the stocks of necessary medicines or substitution therapy or syringes, which was not like that before. And just last Friday, Oxford announced successful trials for anti-malaria vaccine. They say, well, COVID vaccine was registered and approved by WHO within a month. Why can't we do just the same for malaria? So there have been really important lessons learned that we need to take and develop further. And I'm really excited with this meeting because actually it is not as much a story of challenges, but actually a story of finding great solutions and finding a way forward and making our programs in HIV much stronger. So thank you for this opportunity. Thank you, Aida. Thank you, partners, and looking forward for this interesting hour and a half.
Thank you, Tanya. It was great opening. So now I want to invite our colleague from the North Macedonia, Andrej Senih, who will tell us how does the North Macedonia support the essential HIV services. What are the challenges for the key populations in response to COVID pandemic? So let's listen to Andrej Senih, who is the Executive Director of the Stronger Together, on situation in North Macedonia, and let us together see how the country is dealing with problems that have arisen and what is the country doing to overcome these challenges. So with that, Andrej, over to you, please.
Hello, I hope you can all hear me. Can you confirm?
Yes, Andrej, we can hear you well.
Thank you, Aida, very much for the introduction. Thank you, Tanya. As you mentioned, Aida, I will focus on how essential HIV services in North Macedonia for key populations were maintained and even increased in the context of dealing with this pandemic of COVID-19. Some of you may be aware, but I need to say that in terms of HIV services, there is a relatively well-developed and geographically dispersed infrastructure for service delivery for key populations. The most widely spread services are those for people who inject drugs, present in 12 towns, as you can see, and then also for sex workers in 6 main areas where sex work is mostly concentrated. And the lowest coverage is, unfortunately, with the services targeting men who have sex with men, despite the fact that from what we are seeing epidemiologically in the last 10 years, the HIV epidemic in North Macedonia is actually concentrated only in this population. There are also support services for people who live with HIV and also for people who are on opioid substitution treatment. Altogether in this program, there are 14 organizations involved throughout the country. There is also a relatively wide package of different diverse services, starting from the basic prevention packages, distribution, and HIV testing to sexual and reproductive health services, including diagnosis and treatment of STIs, contraception, pregnancy testing, other medical services, as well as a wide variety of social services. All of these services have been covered since 2018 entirely by the National HIV Program of the Ministry of Health, except for the legal support services, which are still resourced from other donors. In March, when COVID started, all the civil society organizations basically had to accommodate their service delivery to the new circumstances. But we believe that we have also significantly contributed to the national response to COVID-19, and this was not least by spreading information and counseling on how to use personal protection against COVID among our clients, what is the proper action to take in case of symptoms, or the official information on the official prevention measures and restrictions imposed by the government, which of course were changing constantly. On the contrary, civil society organizations did much more than this, starting from the fact that most organizations never even interrupted their services, where many, in a time, even in periods where when many state health institutions were actually closed. The approach was to increase the outreach services using outreach workers and mobile units, and of course to increase the traffic control for our staff and clients in the centers. A preference was given of going to clients to provide the services and using the open spaces as much as possible. And of course, as the restrictions and as the epidemic went up and down, the service delivery approach was constantly adjusted to the needs. Most of the organizations performed additional procurements which had not been planned of protection commodities for their clients and for the service providers. All of the organizations provided a number of commodities for their clients, including masks, disinfectants, hygienic pads, symptomatic treatments, and various humanitarian packages. The example, just one of among many to mention, is the sexual and reproductive health centers of HERA in Skopje, where basically the epidemic itself revealed the different needs, so that continuous modifications in the service delivery were made with the main goal to leave no one behind. Of course, special protocols were developed for COVID, and working hours were adjusted according to the restrictions and according to the needs of the clients. In particular, the STI diagnostic package for MSM was increased, as well as gynecological services for female sex workers and for Roma women who were particularly affected by the epidemic in terms of access to health services included. Stronger Together, my organization for support of people living with HIV, together with the Clinic for Infectious Diseases, implemented a system for delivery of ART to the homes or to the towns of patients with HIV living outside of the capital, which was coupled with multi-month dispensing of ARVs, which was implemented, well, for a period of 3 months for the first time by the Clinic for Infectious Diseases. This helped not only to protect patients, but also to relieve the burden on the clinic, since this one clinic responsible for the treatment of HIV was actually the main COVID clinic, has been the main COVID clinic in the last months. Organizations employed many different ways, creative ways to help clients, including engaging their staff and volunteers in producing masks, for example, and performing a number of fundraising actions for humanitarian aid, especially for people who use drugs, families with children who use drugs, and in particular the sex workers community, which was especially affected by the COVID crisis. Additional support in this time was provided by other donors, including the Open Society Foundations, UNFPA, several faith-based organizations, the Red Cross, and others, as well as many individuals. The government did provide additional support for civil society organizations in general, in the amount of about €500,000 total. In terms of HIV services, HOPES, one of our partner and service delivery organizations, did receive a grant. And just so that you have a picture, these were relatively small grants of up to €15,000 per organization. We faced a number of challenges, of course. In the first place, I would like to mention that there were, throughout the year, significant delays in the disbursements of funds from the Ministry of Health, a number of management issues at the Ministry of Health with the National HIV Program. The fact that all the key resources and experts in the country were dispersed on the COVID crisis, and they had to shift their attention from HIV, away from HIV issues. The increased financial burden on CSOs due to the fact that we had to procure large quantities of protection commodities, but also the fact that prices went even up to 30% for these commodities. Unfortunately, as a country, we have one of the slowest rollouts of COVID-19 vaccines in Europe. And key affected populations have not been prioritized, not even people living with HIV, even though we recently have demanded this from the Ministry of Health. Unfortunately, also on the municipal level, there were major cuts for all social services, surprisingly and unexpectedly in this kind of circumstances, from the city of Skopje, which is basically one of the very few municipalities providing support for social services. These are not solutions to the problems, but these are some actions that we could take or benefit from, and basically we had to do with to deal with just making reallocations within the current funding from the National HIV Program. Some organizations could, in exceptional circumstances, rely on reallocations allowed from other donors, but this was rather rare. There was help, as I mentioned, from other donors, but mostly in terms of providing humanitarian aid. And something very specific to COVID, we just recently received the 5,000 COVID rapid antigen tests to enable a quicker access for key populations, for which is going to be implemented in collaboration with one of the main municipal health institutions in Skopje. I would like, do I have some more time?
You have 3 minutes, Andrej.
Great. Just to mention something which I think is very important for us, despite all these challenges around sustaining services, we actually invested a lot of effort to actually start a completely new service to roll out PrEP for the first time in North Macedonia, despite the circumstances. We had made preparations for this even before COVID during 2019, where national PrEP guidelines were developed, as well as a protocol for an implementation study. And at the beginning of 2020, additional funding opportunity became available through the SOS project, which was perfect. It just came when the COVID crisis started, which made things extremely difficult in terms of discussing with the partners, the Clinic for Infectious Diseases in North Macedonia. So instead of mid-2020, there were huge delays, and eventually we were able to start the pilot in January 2021 in partnership between Stronger Together and the Clinic for Infectious Diseases. There is the services are delivered at the clinic. It's a separate HIV center, very much community-based, even though it's a medical environment. Both daily PrEP and event-driven PrEP is offered to clients. The services are offered twice a week, and we also, due to the circumstances, recently piloted outreach service delivery for PrEP using the mobile testing unit for HIV testing. The main focus is on MSM and transgender people. Sex workers are also included, and also everyone else can be included in based on personal risk circumstances. Our target is 100 people, but we are well prepared to go beyond it. A wide variety of services is offered as a package, not simply PrEP, but also HPV, HCV, and STI screening, as well as HPV vaccination, in addition to all the regular stuff. Until now, we have 40 PrEP users enrolled, and the results of the study are we're already seeing some outcomes of the study, considering that we are detecting an epidemic of syphilis, which was obviously unseen and hidden and neglected. We're looking forward to increasing the spread of information and increasing the demand for PrEP. And of course, we are focusing in the next months of advocating for the continuation of these services beyond the SOS project. I hope I was more or less in time, giving you an overview of what the situation has been in North Macedonia. I will be here for questions afterwards. Thank you.
Thank you, Andrej, so much. Yes, you were on time, fantastic. And as usually, this is an inspiring story of success in North Macedonia. We are seeing these stories for years now, and I really want to use the opportunity to congratulate to the government and very strong civil society colleagues from the country who have led to this success. So as Andrej suggested, let's keep our comments and questions for the end, the final part of our presentation and discussion today. Let's move now to, I want to share with you the story from Bosnia and Herzegovina, the country that operates under much more difficult circumstances. You are all aware that unfortunately the transition process in Bosnia didn't work so well, but I'm going to share with you an innovative story of COVID response in Bosnia and Herzegovina, which was done as a part of the regional SOS project under the leadership of Alliance for Public Health. So I will use next 10 to 15 minutes to take you briefly through the COVID situation. So first of all, you are all aware, as you are all from our region, that Bosnia and Herzegovina has very complex health system. As country is fragmented and administratively structured into two entities, one district, and then one of the entities is further decentralized to 10 counties. So all of these 13 layers of the government basically do have authority and mandate for health. And then at the state level, unfortunately, there is no one single Ministry of Health, but we have a Department for Health within the Ministry of Civil Affairs of Bosnia and Herzegovina. So you can imagine how rapid spread of the COVID-19 virus at the beginning of last year has affected such fragmented system where decision-making is difficult under the ordinary circumstances. But at the time of pandemics, it has really grown and led to lots of challenges, some of which you can see at my slides. So at the beginning of pandemic, country faced number of problems, including, as all countries of the region, I would say, the insufficient emergency preparedness, then challenges in the data collection, insufficient number of ICU units, but also that was combined with some of typical challenges for my country that were slow decision making, and then a lack of one unique, unified response to the crisis. So basically, we have lived in a situation where that was unpredictable, that was fast developing. Frankly speaking, we were quite scared of what is going to happen. However, as Tetiana Deshko said at the beginning, the challenge also always presents the opportunity. So looking into the situation, we are not only noting the challenges, but we were also looking for the possibilities with whom and how we can work to collectively contribute to solutions. One of the challenge that I still want to go back to and particularly underline in this presentation is the challenge that was faced by smaller places, smaller cities in Bosnia and Herzegovina, and that was typical across the country. So as pandemic was evolving in bigger cities like Sarajevo, like Mostar, like Banja Luka, yes, there was lots of uncertainty, but also there were ICU units, there were infectious diseases specialists, epidemiologists, and other healthcare professional specialties and profiles available to cope with the epidemic situation, at least to some extent. Unfortunately, situation in small cities was much more difficult because in number of small cities, we did not have available either epidemiology specialists or infectious diseases specialists. So we had situations like in small places like in Konjic, Medjugorje, or other places where the pandemic was starting, and then the health system had to rely on the external resources. Basically, they were publicly even calling for bigger cities, bigger medical centers to send somebody to help them out. And that was really heartbreaking situation. You have the small place where you have the primary healthcare, you have secondary healthcare to some extent, but then because of shortage of healthcare professionals, basically the health system in these places didn't know what to do or how to structure the system and how to respond and how to treat people. So this was really one of the greatest challenges that was noted at the beginning. At that time, Partnerships in Health, as a part of the regional SOS project, was working closely with Sarajevo, Mostar, and Bijeljina, 3 cities who have signed Paris Declaration and therefore have joined the fast track initiative that was established by UNAIDS. So working closely with these relatively large centers, because all 3 centers, Sarajevo, Mostar, and Bijeljina, they have medical centers who are not only providing medical services to these 3 cities, but also to the wider region. So these relatively large centers were also exploring the opportunity together with us, how to support neighboring smaller cities with expertise and other services required for the response to COVID-19 pandemics. So as I said, in collaboration with these 3 cities, we explored the opportunities, and this collaborative process has resulted with development of the application that we have submitted to the Alliance for Public Health, basically having 2 major components. One was procurement of tests for COVID-19. Unfortunately, we have also witnessed here shortage of tests. The availability was limited. And then the protective medical equipment was a big issue at that time, at the beginning of pandemic. So yes, you could procure it, but the availability was not equal, I would say. So you would have to compete in market. The prices have gone up enormously. So we have used the opportunity that was generously offered by the Global Fund to procure tests to the Global Fund's VAMBO platform. So that was a fantastic opportunity to get reliable, high quality tests for the good price. And then the other component of our proposed project was the establishment of the Telemedicine Platform. So as I said, Telemedicine Platform was established in response to problem of shortage of certain medical professionals in some parts of our country, particularly in smaller cities. And we want to bridge this gap by having online telemedicine tool, which would offer a reliable, confidential online space where the health professionals can ask the question, whether the question is about treatment of specific case of a patient infected with COVID-19, whether it is about other related comorbidities where they do not have available health workforce to address the issue, whether the question is about tracing the contacts, so epidemiological question, or the question can be how to structure the COVID center, how to organize testing. There were some questions also received about what kind of comorbidities can be grouped in one room for patients, because as we all know, as those waves of COVID are coming, first wave, second wave, third wave, we are also seeing that capacities of our hospitals are being stretched to the maximum or even beyond that. So sometimes the question is who can be with whom in the same room, and who can share the room without additionally posing a danger for the other people in the room. So basically, we have established the expert pool. These experts are available at the online platform, and healthcare professionals who are asking questions also can upload the medical documents, the X-ray screens and stuff like that. And protection of the data is ensured, confidentiality of data is ensured. So there are no any issues that could pose a risk for the ethical code of conduct of the healthcare professionals. So you can see here, this is the screenshot from the platform. Basically, it says this is the telemedicine platform intended for the healthcare professionals. And the healthcare professionals do go through very quick and simple registration. And then after they register, they can ask the question. Once the question is received, we are forwarding questions to the respective expert to respond to it as soon as possible. Also, you can see here, there is a phone number for the psychological support for the healthcare professionals. This is initiative by the local health authorities. So we have also advertised it here. And then as our project is going, the platform was established in February 21st and will work until the end of August 21st. Questions so far that we are received are mostly related, as I mentioned, to the treatment and isolation of people with COVID-19. And again, the data protection and confidentiality are ensured. In addition to the telemedicine platform, which is kind of innovative and unique approach in Balkans in area of COVID response, but also addressing some of our major issues, our program had also provided the donation of the medical protective equipment and tests to 3 cities, to Sarajevo, Mostar, and Bijeljina. And then we have also organized right at the beginning the webinar to promote this telemedicine platform to the primary healthcare providers, because we are expecting that most of the questions will come from the primary healthcare level. So with this, I will stop here. And as Andrej said, I'm also available to your comments and questions after the end of all presentations. And now I want to invite my colleague, Goran Radisavljević, the Chief Executive Officer of Timok Youth Center from Serbia. So as we all know, Serbia is one of the countries of Eastern Europe that has suffered the most from the influence of COVID. Has Serbia managed to cope with pandemic, having in her resources both access to testing and vaccination against COVID-19? Goran will tell us in brief about the epidemiological situation in Serbia and the current situation related to the new COVID-19 cases. Finally, Goran will also address the issue of the role and challenges of civil society organizations and services for the key affected populations. So with that, Goran, over to you, please.
что среди всех вебинаров и всего
to the instruction of the organizers, I will present the situation in Serbia related to the number of the infected people, but also to the vaccination process. Wait a minute. Okay. At the beginning, I would like to emphasize that the data in the presentation are based on official data from the Institute of Public Health Serbia, Batut, and refer to the period until April 21st, 2021. In the picture, you can see the global distribution of 14 days notification rate of COVID-19 to the 15 April 2021. Serbia is among the highest COVID-19 burn countries in the world. And the current situation is below 2,000 newly infected per day. And in the period shown in the picture, there were about 4,000 people new infected. It should be have in mind that Serbia has a little less than 7 million people. In the Republic of Serbia, the first case of COVID-19 was reported on the 6th March 2020, and the outbreak is still ongoing. On March 15, a state of emergency was introduced, and at that time, 48 citizens in Serbia became infected with COVID-19, and 283 people were tested. Schools, faculties, kindergartens, and gyms were closed, and anyone who came from abroad had to spend 14 days in isolation. A ban on going out of home for people over the age of 65 began on March 16, and the curfew was soon introduced between 8 p.m. later 5 p.m. to 5 in the morning. At the beginning of the April, we had over 2,000 notified cases and about 60 deaths. And in the end of the April, we had 9,000 newly infected people and 179 deaths. On May 7, curfew was cancelled. And at the end of the June, there were elections in Serbia. And in July, there were demonstrations against the reclosure and restrictions of movement. At the moment, the epidemiological situation was stable, but with further decreasing tendency of COVID-19 incidence rate in all parts of the country. However, the SARS-CoV virus is still circulating in the territory of Republic of Serbia. A total of 3,741,146 persons who met the case definition criteria were tested in the Republic of Serbia. From the beginning of the epidemic until April 22, 2021, a total of 673,520 were registered cases of COVID-19, included 6,130 deaths. On the chart, we can see the number of confirmed cases of COVID-19 and the percentage confirmed among the total number of tested persons in the Republic of Serbia. The chart shows two peaks in mid-December and late March to early April 2021. Wait a minute. In this picture, we can see number of deaths of COVID-19 in Serbia. The largest number of deaths was in December, and after the fall in the number of deaths, it increased at the end of the March and the beginning of April. If we make a parallel in the countries of the Western Balkans, we can see that the week from April 5 to 11, Serbia has the largest number of notified cases, which is reflected in 100,000 people. Also, when we look at the number of deaths, it is below Bosnia and Herzegovina and North Macedonia, but the mortality rate per 100,000 population is very low. Such low mortality rate can be attributed to adequate treatment because a large number of hospitals have been transformed to the COVID system, but several COVID hospitals have also been opened. Now we could move to on vaccination. Vaccination, when we look at other parameters, is very successful in Serbia. The national vaccination strategy in Serbia was presented in December 2020. And the National Institute of Public Health, the Batut, has announced an operational plan for immunization, which emphasizes there 3 phases of vaccination, including about 1.75 million people of Serbia. The first phase of vaccination includes the employees in healthcare institutions with the highest risks of transmission in the infection, and employees in nursing homes and social welfare institutions. It is anticipated that the second phase will cover up to 20% of the total population, namely the older age groups that were not vaccinated in the first phase, and those employed in institutions that are important for the function of society. In the third phase, vaccination of employees in educational institutions, primary schools, staff outside the medical and educational sector that is not included in the second phase is planned. On December 24, 2020, Serbia officially started vaccination against COVID-19. The National Drug Agency has approved the use of vaccines, Pfizer, AstraZeneca, Sputnik 5, and Chinese Sinopharm. The application for vaccination can be done over the e-Uprava portal, which is the government's portal for e-government services. On this portal, citizens can choose which vaccine they want to be vaccinated with. Vaccination did not always go according to plan, so it happened that vaccination was carried out for the entire population at certain moments, given the largest number of purchased Chinese vaccine. Also, I think 2 or 3 weeks ago, Serbia opened borders for the country from the regional and for the people from the countries in Western Balkan region can come to Serbia and get vaccine, but in that moment it's only AstraZeneca. The mass immunization campaign was announced for January 11, and by April 21st, 3,093,628 vaccinations has been performed. It's around 43% of the population, while 1,246,047 were vaccinated with the second dose of the selected vaccine. It's around 17–18% of the population. The National Crisis Response Team COVID-19 estimates that mass immunization of the least 1.5 million people to provide immunity to at least 60% of the population, which should prevent epidemic waves in the future, but another 1.5 million people should have been vaccinated to achieve a collective immunity over 80%. On this chart, COVID-19 vaccine doses administered per 100 people chart on April 21st. We can see that Serbia is in 8th place, behind the United Kingdom, United States, Hungary, and the front of Germany, France, and others. Total number of vaccination doses administered per 100 people in total population are around 46. The following chart shows share of people who received at least 1 dose of COVID-19 vaccine on April 21st. Serbia is also in the eighth place with a 27.5%. If you speak about the role of civil society during the COVID-19 pandemic, we can speak in the beginning of support for socially vulnerable groups, also promotion of prevention and social distancing, and now vaccination promotion. If we talk about support for socially vulnerable groups, a large number of civil society organizations got involved in the work of local crisis headquarters and provided help and support through volunteer services. A very important role of civil society organizations is in promotion of prevention and social distancing. People needed to be brought closer to the obligation to wear masks, how to protect themselves, etc. Currently, a very important role in the promotion of vaccination. At the moment, the interest in vaccination has decreased, especially in the population that is subject to the belief of false information. This situation leads to a large number of people not believing vaccine, and the reasons are 5G, chipping, dusting from the air, conspiracy theory, and etc. I have one joke for that, because we have a lot of jokes in our region regarding the COVID, and one joke is related to a conspiracy theory with the interview with Bill Gates, because Bill Gates is one of the most, I don't know, important person in conspiracy theory in Serbia. I hope that it's in all countries in Western Balkan and also in EECA region. And the question is, what was your vision when you founded Microsoft 45 years ago? And the answer from Bill Gates' side, it's to chip Radmila from Požega. Radmila is woman from small city Požega in western part of the Serbia. And this is one joke how we, I don't know, laughing in Serbia, but there is a big problem with the conspiracy theory and with the problem for the vaccination. If we speak about HIV/AIDS services during the COVID-19 pandemic, we heard from Andrej a lot of them, and the services aggravated in early 2020, especially during the lockdown period. This is why civil society organizations have had to find innovative services to provide services to key population. During this period, certain population behaved very risky because parties were organized during the weekend curfew. The party started on Friday at 5 p.m. and ended in the Monday morning. This is why we do not currently know the real number of HIV infections, because a large number of key population have not been tested. And this is reflected in the fact that in 2020, we had only 55 new infected HIV persons. And if you look back in a few years ago, that number was about 3 times higher. In 2019, 175, 2018, 130, and etc. Support the services of the key population functioned and were not interrupted. They were only reduced, and new innovative ways of support were found primarily online. We have also and implementing Global Fund National Grant, and there is 9 organizations who work in the field with key population, and maybe this is the reason why we never stopped the services in Serbia in 2020. In the beginning of 2020, yeah, there is a big problem, and we have a problem how to work with the key population. But I thought that we find some new innovative services, new innovative kinds to work with the key populations. Sometimes go outside and work in the field. We have 9 organizations, 2 from Novi Sad, Prevent and Remix, 1 from Šabac, Duga, Jazas from Belgrade, and Veza also there is Roma Mediators from Belgrade, my organization from Zajedža, who work in south part of Serbia, and also 2 organizations, Potent and Union of Organization, who work with people living with HIV from Belgrade. If we speak about TB services during the COVID-19 pandemic, interrupted, because the TB hospitals have grown into COVID hospitals. I hope that I managed to bring the situation in Serbia closer. It was an honor to be here today and discuss this topic with all of you. And thank you. If you have some question, I will be available to answer you. Thank you again.
Thank you, Goran. That was perfect. And I believe it's fair to say that we all from this region do owe a gratitude to country of Serbia for enabling immunization for so many people from the region. So it's not only people who are citizens of Republic of Serbia, but also people from my country, Bosnia and Herzegovina, from Macedonia, North Macedonia, apologies, Montenegro, and other countries across the region. So you have not only helped your respective country to fight the pandemic, but also you have helped to so many of us. So thank you, Goran, and questions and comments for Goran, please keep them for the end of presentation as for all other speakers.
Sure,
so now we are moving to Montenegro. I'm going to introduce you Ms. Sanja Šišović. Sanja is program director for NGO CAZAS from Montenegro, and she will talk about how services in Montenegro are adopted or have been adopted to the COVID-19 reality. What are the problems that you have faced? And Sanja will also share her plans for the future. So with that short introduction, Sanja, over to you, please.
Thank you, Aida. And I would first of all like to say hi to everyone attending this meeting today, and especially having in mind that holidays are coming soon, so that we are all in a hurry with deadlines. But I believe that it is very important to discuss on regional level about this, as well as to exchange good practices. And I'm happy to share today also the experience of Montenegro regarding COVID. So let's just see if can you see my screen?
Yes, Sanja, we can see it well.
Okay, just to. Okay, so first of all, I would like to briefly present the COVID situation in Montenegro and to outline a few challenges regarding how access to HIV prevention testing and treatment was available in regards to HIV and AIDS during epidemic in Montenegro. So first COVID case in Montenegro was registered in the mid-March in 2020, but weeks before registering first case in Montenegro, lockdown was in place, as well as many other preventive measures, which means that we can say that since the mid of February last year, our country has been partly under the COVID measures, and constantly we had to adjust to the new situation. Previous year, which I think that was mostly influenced by COVID everywhere in the world, now I believe that in 2021 it's a new reality, and it's something which is already a new normal for all of us. But in the previous year we had very mixed situation regarding COVID in Montenegro, which means that in first 2 quarters we were faced with total lockdown. Then for a few months we were a corona-free country, which somehow gave us the possibility to bring back things as they were before. But then since August, September, with elections, protests and everything, we had a new epidemic and escalating very, very fast, that again led us to some kind of lockdown, which means that we had constantly to go up and down with adjustments regarding the service provisions. So currently Montenegro is a country that has still high level of new cases. But for a long time, we were among top-rated countries in the world per number of registered cases per million citizens, which means that we had constantly to how to say, work in a very, very crisis situation. So regarding the access to treatment, to prevention, treatment and care services in Montenegro, what we are very proud of in Montenegro is that no matter how serious situation with COVID it was, all preventive services were constantly available, which means that we didn't have situations like in other countries that we had to shut down service provision or that we had to stop the prevention programs. Constantly, these programs were working under very difficult circumstances, but they worked. They were available for all key populations. Regarding treatment, treatment was also provided continuously with, of course, a higher level of CSO's involvement in distribution of treatment, but I will later on present also that. While care and testing services were also available, but on a limited level. Partners of the SOS project in Montenegro are organizations that are at the same time service providers working with different vulnerable groups in regards to COVID. So our partners, Juventus, Clear Montenegro, MHF, and Foundation Zaštita, they work with different populations, from people who inject drugs, people who live with HIV, MSM, sex workers, but also sailors, Roma populations, and other vulnerable groups. So as very, let's say, mixed group of organizations, we constantly together worked on adjusting services to the epidemiological situations. And we tried to maintain prevention programs active and available for all key populations. Why this was challenging? Because as in the last year, it is also the case now, for example, we are not able to travel between the cities, and now it is just weekends, but until a week ago, you were not allowed to travel between the cities, not with public transport or by your own car. And that was, for example, a huge challenge for outreach work, but we managed to somehow provide support and provide permissions to travel in order to provide outreach. But for example, this was a huge challenge also for people who are taking treatment doses or, for example, OST services outside of the place where they live, which means that they didn't have access to services, and we had to adjust somehow to expand even the cities that we were covering in previous times so that we could reach all the clients needed. This was very challenging, but as I said, all organizations working have successfully adjusted their services to the epidemiological situations. According to data that we gathered, and I agree with colleagues from Bosnia and from other countries that collecting any kind of data which is not COVID was very challenging in this period. While COVID is teaching us that if we want, we do have the opportunity to really effectively share data and track epidemic, but somehow the data were not always available for everything that we needed to have. But according to data that we collected, access to testing was provided and VCT centers were available, as well as community testing organized among NGOs. Community testing is not something which is always available in Montenegro. I believe that all Balkan colleagues are aware of that, but we, from time to time, in cooperation with institutions, NGOs organize community testing in drop-in centers or in other facilities run by NGOs. So during COVID, those kind of testings were organized, and it was very important to have that because Montenegro is, even without COVID, country with the lowest testing rate in Europe, which means that that was additionally challenged with during COVID, because most of the testing centers in Montenegro are within the primary healthcare centers, which means that now some of them were COVID centers, which means that even though they were formally opened, it was very hard to access them. While on the other side, due to COVID, people were afraid to actually enter the health facility, which is why this community testing organized by our colleagues and by us was very, very useful. Partner NGOs, especially organization Montenegrin HIV Foundation, working with people who live with HIV, was extremely helpful during COVID, because distribution of therapy and treatment of people who live with HIV in Montenegro is centralized, which means that only, no matter where you live in Montenegro, you have to be treated by an infectologist that works in a clinical center in Podgorica, which is a capital city, and you need to visit them in order to have your recipes to take your treatment or your antiretroviral drugs, and they can be collected only in one pharmacy in Podgorica, and that is something that was decided due to privacy and other issues. And what was challenged during COVID is that because of a lot of bans of movement, lot of other measures that were in place, but also a lot of people has been isolated or quarantined during this period, people who live with HIV had challenges in terms of this, but our colleagues from MHF have done really amazing job, and they were constantly cooperating with VCT Center in the Institute of Public Health and with Clinic for Infection Diseases. And together they've created the system in which they were collecting treatment for or therapy for people who live with HIV and AIDS. And they then distributed those doses for people who need that. They were also actively involved in supporting people who were working with, who were stuck, let's say, stuck sometimes in Montenegro, but needed treatment. So the role of CSOs was also very important for distribution of buprenorphine for people who live, people who inject drugs, who were isolated or live in other cities. Tsazas has signed an agreement with the psychiatric clinic, and we were distributing buprenorphine for people who were isolated or quarantined and could not move. Constantly, food and hygiene packages were distributed. But what was the challenge is that the protection equipment for COVID, which we were obliged to have, was very limited and very hard to find. And somehow we managed to do that, but still there were many challenges that we faced during pandemic. First of all, the 2020 in Montenegro was not just how to say, marked with COVID. It was also marked with very huge political changes that happened, that after 30 years, the ruling party has fell down and the new composition came. And there is a lot of things that are still not solved due to transition of the ruling functions. And we have a situation that even though we have a support of the Global Fund for Services Provision, our contracts ended in March. And we still didn't receive funds for the continuation of the project, which means that since 12th of March, we are running our services how we know, without funds. And we are constantly advocating with the Ministry of Health and CCM, but also we are in communication with the Global Fund to try to find a way to actually provide continuation of the services by announcing the call for proposal or finding another modality for distribution of the already existing funds for this. Another challenge that we faced due to COVID is that most of our clients have new needs. Most of them are now homeless, have lost their job, have very serious and hard socioeconomic situation, and we actually had to spread the services that we were providing, and we had to actually also discuss new models for service provision, like online service provision or using other methods. As I already mentioned, the COVID measures actually in a lot of cases banned movement. We had to actually limited the number of people. We had to shut down some of the services in the drop-in centers, like showering and stuff like that, which was very hard for people who actually need those services because they're homeless or they are without electricity in the places where they live or similar to that. Another thing which was very, very, let's say, bad is that our staff was exposed to COVID. And even though we maintained, like all service providers maintained under control, some of the staff, unfortunately lost their battles. So our colleagues from Juventus actually lost one of their member due to COVID. And it is something that is really, really, really bad. And regarding other, because Aida is warning me regarding my time, another thing is that key results achieved is that actually we have been able to provide prevention testing and treatment continuously, and that even in the COVID era we managed to conduct in November and December IBBS survey among people who inject drugs. And another achievement is that actually all indicators national that we planned are achieved. And I think that that is just telling that we have services that are quality and that are able to adjust even situations when we don't have sustainability or funds, and that we are able to conduct services even during pandemic era. To conclude, regarding the future plans, what we are currently working on, we are happy that regional SOS project has recognized the need of Montenegro to support us with tests. So 5,000 COVID tests was donated, and SAZAS is currently in process of importing those tests in Montenegro. Initially, it was planned to distribute those tests to service providers in order to test staff, key populations and staff, but due to national protocol for COVID testing, those tests will be donated to primary healthcare center. And later on in negotiations with them, we will define how key populations can be served with those tests. And we are very thankful to the Global Fund, to the Alliance for Public Health for supporting us in this very, very challenging period. Aida, sorry if I took more than I had. I am still available for all the questions later, and it was my pleasure to share experience of our country. So let me just stop.
Thank you, Senih, so much. What a story from Montenegro. So despite all challenges, the country and civil society is still finding a way to support the key affected populations. But think just for 1 second, where we would have been now, how different it would be without the Global Fund and the regional SOS project. So basically, a part of couple of, unfortunately, still very few good examples of sustainability stories and responsible response to diseases. We are still quite far away, if I may note, from the sustainability and sustainable response to both TB and HIV in countries of Balkans. This is really concerning situation. But let's keep comments and questions for the end. So without further ado, I'm going to introduce your last speaker and presenter today. It is Dr. Fifa Rahman from the Matahari Global Solutions from the United Kingdom. So the SOS project has conducted a study recently on the impact of COVID-19 on sustainability of HIV and TB services in 6 countries of the Eastern Europe, Central Asia, and Balkans. One of the countries that took part in this study was Bosnia and Herzegovina. Today, we can listen to results of the study on Bosnia and Herzegovina, which will be presented by Dr. Fifa, who was principal researcher of the Matahari Global Solutions and the direct leader of these studies. Also, I mentioned earlier that situation in Bosnia is quite challenging. So let's hear more details from Fifa. Fifa, over to you, please.
Thanks so much, Aida. And what I'm going to do is going to present a little tiny bit of summary for all the 6 countries and then go more in depth in Bosnia and Herzegovina. Can everybody see my slides all right?
Yes, really well.
Great. So first of all, out of the 6 countries that were studied, Bosnia and Herzegovina had the highest COVID-19 deaths per capita. And what happened was we saw across all 6 countries a decrease of in-person meetings with clinicians and a scale up of mobile and e-health solutions. We also saw across 6 countries that there's inadequate social safety net for PL-HIV and TB populations. What this means is that there wasn't basically a way to solve the losses of income due to COVID, and there wasn't government support in terms of direct cash support or transport support for these populations. In addition, there was inadequate psychosocial support intervention across all 6 countries and a reduction in HIV screening and TB detection. So in terms of the COVID response in Bosnia and Herzegovina, and Aida has already told you about some of this, including the fragmented health systems and different cantons, each having decision-making power in terms of their health system and procurement. So the fragmentation did not help in the situation of a pandemic. An epidemiologist spoke about the premature relaxation of COVID measures and resulting in the organization of mass gatherings, causing the rise in COVID infections. And of course, the health system was overwhelmed, and this saw effects on contact tracing. Dr. Senih spoke about how in the start, they were okay with contact tracing, and they did this in person in the start, then transitioned to phone contact tracing. But after that, they were too busy and they couldn't follow all the traces. Dr. Antonia Verhas, from Banja Luka said that there's a problem with ideologies around infectious diseases studies. So she said that the number of specialists for infectious diseases was very small because it was kind of understood or thought that infectious diseases was a disease of the past. So what they wanted is that in the future, there will be increased investment in infectious diseases studies. The next slide shows the effects on HIV services in Bosnia and Herzegovina. And of course, it's a low prevalence country, but in recent years has seen a 3-fold increase in infections among men who have sex with men. And of course, what Aida mentioned just now about having a poor transition, this has influenced how all key affected populations have received services. So there are pre-existing inequalities due to differential access to ARVs. And what this means is because of what the fragmented system imposes, which is different cantons have different medication regimens. And as a result, there is sort of discriminatory access. So it depends on where you live, and depending on where you live, you get better or worse quality medications. The next was that COVID and the restrictions around COVID reduced access to testing centers. The infectious diseases clinician from Banja Luka said the VCT center at the time of the study, and this was published in March, said that the VCT center was closed and it was moved to another location, and that the new location was under construction. And so that it wasn't possible to conduct testing there. She also said that she thought that the people living with HIV in Republika Srpska was far greater than the numbers show. So there's a need to obviously increase testing in that regard. And the next is a quote from Aida from the report, which says that that there was a transmission of treatments via post, but this was only from the lead infectious diseases specialist in Sarajevo. But this hasn't been heard of in other parts of Bosnia and Herzegovina. But of course, this study was done in March, so this might have been updated since then. And Aida, please update if this has changed and that there's more transmission of the ARVs through post since the study was published. And of course, there's pre-existing effects of poor transition that occurred before the pandemic. So we spoke to an MSM person who said that the drop-in centers and the support services were basically non-existent, and that this was a result of the poor transition. In addition, we spoke to local harm reduction services in Tuzla, who said that harm reduction services were fast running out of money and they would have to stop. And in Tuzla, these services were provided for 2,000 to approximately 4,000 people who use drugs and sex workers, who would no longer have services without something drastically done. So this is a picture of a lawyer and outreach staff of Association Margina in Tuzla. And it's quite clear that they're running out of money, and it's going to be quite a huge impact. In addition, Denis Dedajic also spoke about the impact on unemployed people. While there's some support, it's not sustainable. And he guesses or estimates that since the COVID pandemic, unemployment in Bosnia and Herzegovina will have risen. So in terms of TB, out of the 6 countries we examined, it was more difficult to get information about TB in Bosnia and Herzegovina. And if you look at the country reports, you'll see that the section on TB in Bosnia and Herzegovina is more sparse compared to the other 6 countries. So I think a deeper study needs to happen in terms of TB services in Bosnia and Herzegovina. But basically what we found from the limited information that we had was that rural areas don't have access to microbiology facilities and submit the samples to family doctors, and that they have to pay for initial diagnostic tests, and where reimbursements are available, they are bureaucratically complex to get. And you see on the screen the list of available drugs, which are isoniazid, rifampicin, pyrazinamide, ethambutol, and streptomycin. As you can see, there's no dilaminid and bedaquiline, which are the newer drugs for MDR-TB. And we got this from the joint head of the Head for Lung Diseases and the head of COVID department of the Birchko District Hospital. So the new drugs are not available, and there's an extremely low treatment success rate, which is from WHO statistics, 28% success in new and relapsed cases. So when we finalized the report, we asked Stop TB Partnership to review this, and they said what is urgently needed is some kind of electronic surveillance mechanism to improve the low treatment success rate and understand why this is going on. Also from the report is another quote from Aida, which shows that there isn't a sufficiently robust TB civil society in Bosnia and Herzegovina. And there's definitely needed in terms of urgent funding to help strengthen this point, to make sure that we're not looking at TB from just a medicalized perspective, but also from the social aspects. So in our report, we had several findings that needed to be done or recommendations, and these include some of these, but we need emergency overseas development assistance for MSM and PWID in the country. And of course, AIDA is working on social contracting laws that would enable local NGOs to work in and implement social services programs. More robust CSO community movements in TB definitely needed. The electronic surveillance I spoke about, that's necessary to improve treatment success. Investments in infectious diseases staffing, and one thing that's very important that we mentioned and we wrote about in Global Health Now for all 6 countries was that direct cash support be provided for HIV and TB communities that have lost their income during the pandemic. So I don't know if I've kept the time, but happy to take any questions.
Excellent work with time. Thank you, FIFA. So just to add to your presentation, in terms of what has changed in a couple of last months in Bosnia and Herzegovina. So the procurement of the antiretroviral drugs has been centralized now in Federation of Bosnia and Herzegovina. According to the positive legislation in country, we cannot have it more centralized than that. So instead of having procurement being conducted by clinical centers, now the Federal Health Insurance Fund will and is already actually procuring the antiretroviral drugs for all treatment centers providing antiretroviral treatment in Federation. So therefore, we have managed to address the concern and the issue of discrimination of people living with HIV on the basis of place of their residence. So at least in Federation now, all people with HIV and AIDS will have the same access to the same quite high quality list of drugs of 14 antiretroviral drugs. Secondly, we have also been very successful in our advocacy with one additional clinical center, that is a clinical center in Mostar, where Siniša Kočibušić, whom you mentioned, will start providing the antiretroviral treatment as of September 2021, so this year. So instead of having the antiretroviral treatment available only in Sarajevo and Tuzla, we will have it offered to the people living with HIV also in Mostar. This will reduce the travel cost, and also the time that must be consumed to go and receive the treatment. So basically part of the problem has been solved. For the another part of country, for Republic of Srpska, we have received commitment from the head of the Health Insurance Fund that the list of the available drugs, which is now only at 5 or 6 antiretroviral drugs available, this list is going to be expanded by the end of the year to include more antiretroviral drugs and basically to modernize the treatment. At this point of time, I still do not know how many drugs are going to be introduced in Republic of Srpska, but I'm looking forward so much for this development. And then regarding the direct cash support for people living with HIV, Partnerships in Health has actually introduced that service in the last 6 months. So we have already offered one cycle of the vouchers where the people living with HIV can procure, they can purchase food and hygiene supplies. So that is available and will be available again within next month or two. We are waiting for funds to arrive. Unfortunately, in TB area, nothing has changed. So we still do not see any activism. Even people who have had TB, once they have been cured, they do not recognize themselves anymore as part of the TB community. So that is the key challenge, really. There is no TB community and there is no aspiration to have one. So we have established regional Southeastern Europe HIV and TB community network, but it takes time to build a community and to build this recognition of the common challenge, because TB is curable, it is treatable disease, and unfortunately, once after being treated, people do not recognize that they belong to that community anymore. So I'll just stop there. We have done a wonderful job saving the time and keeping the track of the time. So let's move to comments and questions. So you are invited to offer your comments and questions either in chat or verbally. I'm going to start with the first question that was asked by Tetiana Deshko to all speakers that have presented about mental health challenges. So what is the situation of the mental health in people living with HIV and key affected populations during COVID-19? So I've been sharing that for past months many times, that one of really heartbreaking messages that we keep receiving from people with HIV, but also key affected population, is that people are feeling isolated. People are feeling left behind because the healthcare institutions are all of a sudden very difficult to access. The healthcare professionals, particularly infectious diseases specialists, have been transferred to the COVID response mostly, so it's hard to access the treatment, it is hard to access the test, and people feel that they are being unimportant to society anymore. So this has huge influence and huge implications, and it is really hard to cope with and deal with. I know that Sanja wanted also to comment from Montenegro on this same question. So Sanja, do you want to add?
Okay, I lost you for a minute. Do you hear me?
Yes, I can hear you well. So do you want to comment on the mental health of the people living with HIV and key affected populations under COVID-19 pandemic circumstances?
Yes, as I already mentioned in my presentation, there are increase of, let's say, insecurity, increase of anxiety and depression among key population. But also in Montenegro, we worked a lot in the area of mental health, and we also provided free psychotreatment sessions during COVID. And what we have noticed is what statistics support. In Montenegro, there is increase of suicides, and compared to statistics that Tanya shared in the comments, just yesterday, police exited and said that we have doubled the cases of suicides in general in Montenegro, which is just a signal that mental health of our citizens is a huge problem, and especially among those who are vulnerable. What we have noticed in Montenegro among our services is that a worsening socioeconomic situation is additionally worsening the vulnerabilities of key population, which means that how to say, we have a situation in which there is a problematic COVID situation, where there is worsen of the socio-economic situation, and as a consequence, we have jeopardized mental health and well-being of our clients. The problem is that we cannot provide all services that they need in terms of mental health. And the health system in general is very vulnerable towards the mental health, and even if we know that that is a problem, there are limitations how and where to refer them, which means that we already advocated for a system, and we discussed with all relevant ministries to try to prepare, because all analyses are showing that the new pandemic coming, especially in most affected countries with COVID, will actually be pandemic of mental health. So I really think that it is important to also talk that. Another thing is the mental health, not just of key population, but of our staff. And we have staff who is very close to burnout and who is very close to working under constantly. We have more than a year environment in which our colleagues are working in a crisis period. And that also results with very serious burnout and mental challenges. At the moment, we are conducting survey among vulnerable groups and key populations in terms of HIV, to try to collect data on the impact of the pandemic to their mental health. And I hope that in the summer we will have those data, and that we will actually see what are the results in this area.
Thank you, Sanja, so much. Anybody of presenters, do you want to step in and comment? Andrej, I see your hand.
Yes, I can also comment on, I see a couple of questions here, but regarding the mental health, I don't have numbers, but what I know is that the demand for psychosocial, psychological support services has been quite steady, and it is a fact that throughout the HIV services there are psychologists, even psychiatrists in some settings available, as well as the Clinic for Infectious Diseases. Yes, it's a service that has been available and widely used. Regarding, there's also, I see some comments here, questions of whether the findings of the research in Bosnia can be generalized. To a large extent, yes, of course, there are differences, but to a largest extent, we have been dealing with a very, very chaotic response and unprepared institutions, and this was not a surprise. If somebody from Ministry of Health is listening now, I apologize, but it's the response of this institution has been extremely chaotic. Our service providers, including social workers, have not until now have not received any priority for vaccinations, unlike other state service providers of services who are exposed. We have demanded this especially for people who inject drugs, for people living with HIV, and for our service providers, but we are still waiting for response. In general, as I mentioned, the rollout of vaccines is extremely slow in the country, so we cannot even expect to have it anytime soon, unfortunately. Well, I hope, but it's still not, we are still not seeing a date, for example.
Thank you, Andrej, for that. So basically the last part of your response about extremely slow immunization, quite confusing messaging and poor coordination, everything that you just said for North Macedonia can go easily for Bosnia as well. Moving to the next question, I will try to make sure that we address all questions and comments. Goran and FIFA, I know that you have been chatting about the availability of TB medicines in Serbia, so bedaquiline and others. So FIFA, Goran, FIFA, do you have a response to your question, or we can call Goran now?
First, I must check that information. I sent the message to the some doctors and medical doctors, but I don't receive answer yet. When I receive the answer, I will share with the FIFA regarding TB and TB medicines and patients and that's in Serbia.
Excellent.
And if it's very shortly regarding mental health in Serbia, I said that the support for people living with HIV is being implemented through a National Global Fund project. And also in presentation, I said that we have 2 organizations that deal with support and self-support and cover most of the territory of the Serbia. And also there is one question maybe for a vaccination plan. Also, I said that we have a national strategy for immunization and an action plan with the 3 parts. Thank you.
Okay, thank you, Goran, for that. So I just want to invite you to be concise and short in your answers too. So the next question from Nadia: is there a vaccination plan in which groups include social workers and vulnerable groups in each country? Or perhaps these groups already have access. So I can speak for Bosnia. So immunization is at very slow rate. The healthcare professionals are the first priority. The second are people above 75 of age with chronic illness, and then they will progress further. I do not have much of clarity when that will happen due to the slow and again quite challenging vaccine supply. So the progress is really challenging. Senih, do you want to put comment on that quickly?
Yes, quickly. We have pretty much similar cascade of priorities, but what is a good thing is that we received the confirmation from the Institute of Public Health as a leader of the strategy for immunization that people living with HIV and AIDS are actually recognized as part of as a group of people living with chronic conditions, which means that they are prioritized for immunization. But what we miss is lack of information on whether, in which cases and which kind of vaccine they should receive, which is resulting in very low interest by that group for immunization. Regarding the social workers and staff of the harm reduction and other prevention services, we are not officially recognized in the immunization document, but the Institute of Public Health has grouped us into health workers. So if we want, we can be as a priority group, and already part of the colleagues has been vaccinated in the previous period. Still, vaccination is going, but there is very low interest. But I think that it's not going to be a problem to have vaccines to vaccinate all staff members that they want. Years ago, our staff has been also be vaccinated with the same principle with the Institute of Public Health. So it's a good that we are recognized in that area.
That is excellent news, because you can see in the chat a number of comments coming from Denis Andrej about the fragmented system for decision making, the corruption that we have been reporting in Bosnia for decades now. FIFA has even shared a great photo of protests that citizens of our country here in Sarajevo have organized, basically demanding and asking and urging immunization program. So this complexity of the administrative structure of the country is also a great excuse for so many leaders who are failing to deliver a proper immunization program here, unfortunately. So as much as it is real challenge and real obstacle, it is also offering the great excuse. And I agree with everything that is written here. And then another comment also from Denis about key affected populations which are additionally marginalized. I believe Sanja has been addressing this already. People do not have health insurance because they are not employed. So a number of injecting drug users have moved to homeless situation, unfortunately, again, without regular health insurance, as I mentioned. And then also protection of the staff working for civil society. We have not been prioritized in any of these plans. So regardless of the work with key affected population, regardless of the exposure risk, unfortunately, we do not have situation like Sanja, you mentioned in Montenegro, where you can be immunized as priority. So this is yet additional layer of complexity here. And thank you, Denis, for these comments that you are putting in here. All of this is unfortunate reality, which is the fact for a couple of last years because of failure in implementation of transition plan. I know that there is ongoing survey that EFRA is conducting about the transition plan in Bosnia, and I contributed to that with one comment. Basically, we did not implement properly the transition plan because the government didn't commit funding and the agencies, proper agencies, didn't take it over. So we are doing it now, unfortunately, 3 years after the end of the last funding from the Global Fund directly to the country, so national funding. So with this, we are 2 minutes over time. I want to thank all of you, to our dear participants, for finding time to join this meeting in variety of meetings that are being offered. We are living in the sort of crowded internet days where there are so many webinars every day offered. So thank you for selecting this meeting. Thank you for your active participation and your generosity in sharing your comments and questions. Warm thank and special gratitude also to our great presenters for sharing stories, incredible stories of hope and opportunity in such difficult situation under such horrible circumstances that we are just witnessing unprecedented situations every day. So thank you all very much. And again, overall, thank you to the Alliance for Public Health from Ukraine for organizing this call and for supporting all these initiatives that have led to the successes that we are presented today, and that are actually, you know what, they are just enabling us to see the end, the light at the end of this tunnel. So let's keep our hope, let's keep our great work. Let's stay strong, stay positive, and stay safe. So thank you from my end, and have a great day. Bye.
Thank you.